Hi, this is Dr. Ahadia. Discussion about atypical bipolar disorder and the differences between that and the regular bipolar disorder. Regular bipolar disorder is a condition as it's been known as manic depressive disorder. Now they've changed that in the diagnostic criteria, and the diagnosis caused as bipolar disorder. Basically a situation that we have a lot of up and downs and long-term conditions with regard to hypo to hypermania and manic condition to going back to depressive side of it with poor motivation and losses and negativistic ideation. Now the term atypical bipolar disorder, which is not typical bipolar disorder, basically is a condition very common these days as far as diagnosis, as far as I can say with regard to the Southern California diagnostic mode and seeing the patients, which is a condition that we have unstable mood, up and downs, very irregular type of a relatedness, going through cycles of anger, depression, aggravation, frustration, irritability, crying, explosive affect, very hyper and irritable throughout even a day. That is usually been diagnosed and detected. And the important thing at present time, I don't want to discuss the mechanism of action and the theories about chemical imbalances causing this kind of situation, which is a big discussion by itself, and genetic predisposition, which again is a big issue, which to my opinion basically is very related and transmitted through the genes in the familial background. However, the issue with regard to the treatment of this kind of conditions is very optimistic. There's a lot of different types of medication currently used for stabilizing the mood. They call it mood stabilizer. Mood stabilizer basically are medications that are being utilized at present time to deal with the stabilization of mood and affect in the situations related to the atypical bipolar disorder. And there are several of them are the atypical antipsychotic medication. When we say atypical antipsychotic medication, and when we talk about antipsychotic medication, it doesn't mean that a person has to be completely psychotic and delusional and being ousted by the society to be given antipsychotic medication to deal with the atypical bipolar symptoms. The mechanism of action of this kind of atypical antipsychotic medication is important to understand, that is helpful with regard to treatment of this disorder. Also, anti-seizure medications are being utilized to take care of the atypicality of the symptomatology and the changes of the mood that is being seen in the atypical bipolar disorder, which is based on a somehow ideation that possibility of very mini seizure type of conditions could cause this storm system and changes in the brain system, and exhibition of all this symptomatology, which is being taken care of and helped by the atypical antipsychotics and also the anti-seizure medications. I hope we will discuss that more in the website and in the emails. If there's any questions, please let me know. Thank you.